So this topic is about the use of the brain imaging technique which we call the fMRI EEG in diagnosing the mental illness. So the table of content is about the brain imaging techniques, the functional magnetic resonance imaging which we call the fMRI, the electroencephalogram which we call the EEG, and the fMRI versus EEG. So firstly we describe the brain imaging technique which we call the BIT. Brain imaging techniques are scientific methods used to see the brain structure and activity. They help doctors to understand how the brain works. These methods are useful in studying the mental disorder. What is the brain imaging? So scientific way to study the brain is the non-invasive methods. No surgery have been required. Show the brain structure, show the brain function, and use in the diagnosis. So the mental illness and the brain. For example, the mental illness affect the thinking, it affect the emotions, it affect the behavior. Brain controls the mental process. Disorders show the brain changes, and brain study improve the understanding. So the types of the brain imaging are the fMRI, which studies the brain activity, EEG, which record the electrical signal, CT scan, which show the structure of the brain, MRI, which give the detailed image of the body, and PET, which show the metabolism. So what is the fMRI? fMRI means the functional MRI. It measures the brain activity based on a blood flow. It active areas and need oxygen. So the blood flow increase, the activity is detected. So this is the journal image of the fMRI which has been used for detections of the any brain problem. How the working of MRI take place? Basically, the person perform the task, the brain area activities, the oxygen demand will be increased, so the blood flow will be increased, and the scanners detect the changes, and the images are produced. So the fMRI have been used to study the depression, study the schizophrenia, study the anxiety, study the memory research, emotions processing, and the decision making. What is the advantage of the fMRI? Having the high quality image show the specific areas, having non-invasive methods, having no radiations required, and the accurate results will be observed. What are the limitations of the fMRI? It is very much expensive, time consuming, not easily available, having sensitive to the movements and cannot diagnose alone, need very much experts. Now we define what is the EEG. Basically, the EEG means the electroencephalogram. It records the electrical activity, use the scalp electrodes, which measure the brain waves and show the real-time activity for the safe and painless. EEG image have been observed in this picture. So working on the EEG, the electrodes placed on the skull, so the neuron produce the signals are detected and the brain waves will be recorded and the patterns analyzed to result the interpreted. Brain waves in the EEG. Basically, there are different waves like the alpha waves, which have been the relax, the beta waves, which have been used for the thinking, the theta waves, which are in the sleepy condition, the delta waves, which are in the deep sleep and used in the diagnosis. So the EEG will be used for the epilepsy detections, for sleep disorder studies, ADHD assessment, schizophrenia, brain injury monitoring, seizure analysis, and the consciousness check. What are the advantage of the EEG? Having the low cost, fast results, portable equipment, easy to use, real-time monitoring, and widely available. So there is some limitations of the EEG. For example, low image detail cannot show the structure, effect by the noise, and the limited accuracy need the expert analysis used for other tests. So there is some difference between the fMRI versus EEG. fMRI basically measured the blood flow, while the EEG measured the electricity. fMRI has the high detail. For example, EEG is the fast, while fMRI is very much expensive, and EEG having the low cost. There is some ethical issues, for example, the patient's privacy, the data protections, the misuse risk, the informed consent, the responsible use, and the ethical roles. What are the role in the treatments? For example, treatments planning, monitor the progress, check the therapy effect, guide the medications, improve the outcomes, and support the doctors. What are the future of the brain imaging? Basically, they have been advanced technology, more accuracy, early diagnostics, personalized cares, AI uses, and better mental health. So, as a concluding marks, brain imaging is very much important, while fMRI and EEG making a key tools. It help to diagnosis, improve the treatment, support the psychology, and modern health care. Thank you so much.